I would like to introduce our first speaker, who is Dr. Patri Masterson Algar. Patri is a postdoc research officer at Bangor University, and she'll be discussing some of her work around the impact of COVID-19 on the care and quality of life of people living with dementia and their carers. So Patri, over to you.
Okay. Hello, good morning. Everyone can hear me okay? I hope so. Oh, there we go. Okay, so yes, my name is Patricia and I work in CADR. And this morning, I'm going to tell you a little bit about a scoping review that we've done, looking at published research, looking at the impact of COVID-19 on the care and the quality of life of people with dementia and their carers. So the first thing I'd like to do is I'll introduce you a little bit to the team. So Jill, you've just met. And then the rest of the people are working CADR. There's some based in Swansea, some based in North Wales, like myself, and Nora, for example, that's based in Canada. All the information is in the website if you're interested. But I thought that what I could do now before we continue is for myself to have a little idea of who is here today. I thought I would use the poll option thing. And see whether you would mind answering which is the reason for attending the conference today. So are you a carer? Are you a person with dementia? Are you a researcher, a health and social care professional, or other? If you don't mind answering that, it just gives me a little bit of idea of who's here today. I will tick that I am a researcher, and hopefully we can get those results quickly. And all it is for me to have an idea of who's listening. Hopefully there's a mixture, but it'll be interesting to see because I can see there's 60 people here today. So let's see. This is quite intriguing. Let's see. Oh, does it come out? Oh, yeah, there we go. Okay, so we have the majority researchers other in healthcare professions. That's intriguing as well. Whenever it's the other, you don't really know when you're. So if you want to write in the chat why the reason for attending the conference, fine. Otherwise, I have an idea now of who is listening. So thank you very much for that. So in this scope and review, we had two major review questions that we wanted to answer. The first one was, how has COVID-19 and the linked changes in provision of services influenced the care and the quality of life of people with dementia and their family carers? But also we wanted to know, how has the impact differ according to, for example, the type of diagnosis, the illness severity, or other relevant demographic characteristics. So I'm gonna try to go quite quickly. I haven't got much time, but I'll give you an overall view of what results we found. So we included 29 studies. And amongst these studies, there were a mixture of quite a number of them looking specifically at the consequences of COVID-19 on symptoms. So neuropsychiatric, cognitive, and psychological symptoms of people living with dementia and their carers. A number of studies were very specifically looking at the impact of the loss and the reduction of services, both for people living with dementia and their carers. Another number of them looked at how technological adaptation of services had worked or not worked. So how all this switching onto online delivery and things like that was working. The majority of the studies were based in Europe. We had some from Argentina, India, Canada, the United States, but the majority were based in Europe. Another thing is that most of the studies were set within the community. So most of the participants included in these studies were people living with dementia, living at home, and their carers. We won't be able to say that this review gave us a full picture of the whole spectrum of society, because we did identify a lack of diversity. Most of the participants were white, and there was very little representation from minorities. So we have to be aware of that. In terms of data collection, primarily most of the studies collected the data using online surveys and telephone calls. And obviously that in itself is another important thing to keep in mind, because not everybody is going to have access to an online survey or want to answer the phone. So obviously it's a very specific way of collecting data. So the first thing I'll talk to you about is what did we find in regards to the impact that COVID-19 had is having on people with dementia. So the first thing that is important to say is that there is evidence in most studies reported negative impacts on cognitive symptoms such as memory, orientation abilities, and difficulty concentrating, but also on functional decline in terms of reduced level of independence in personal care and housekeeping. 9 studies reported as well negative impact on apathy, anxiety, agitation, and aggression, as well as on depression of people with dementia. So that was in itself quite revealing, and the evidence was quite clear. But something else that the evidence showed is that there had been a reduction in specialist care for people with dementia. So things like specialist dementia wards or specialist therapy treatment, and that might have had an impact on the quality of care. Most of the reduction in staff, for example, was due to redeployment, to sickness, and to shielding. And obviously the negative impact of quality of care was mentioned in most of the studies. And in particular, a number of the studies discussed the discharge process, because they had identified that in many cases, it had been rushed or poorly planned or unsafe. And that could have led to an increase in the length of hospital stay for people with dementia. Another thing that was identified in a number of the studies was that there had been an increase in the use of technology. I'm sure this doesn't come as a surprise to anybody. So there's 2 different types of use of technology. So one of them is in regards to telemedicine. So a number of services were now done online by a phone call, for example, the GP. And there isn't a lot of evidence in the review, but the papers that discuss this reported that there was not much difference between the efficacy of comparing, for example, in-person diagnosis with diagnosis made by video conference, and that overall, this type of approach had been shown to be acceptable for people with dementia and their carers. They also explained that there could be a potential benefit of enabling in these approaches, so that people with, for example, geographical constraints or with reduced mobility could access specialist services that maybe before were not really at hand or were very inconvenient in terms of having to go where the specialist service was. There's also, importantly, a lack of evidence overall of how these technological adaptations are being used and their impact. So we still need to do a lot of work, and we still need to look at research assessing how these adaptations are fit for purpose. And very importantly, many of the studies mention explicitly that technological adaptations should supplement face-to-face social activities, but never replace. There was quite a lot of emphasis on that, but as I said, there wasn't enough evidence. They also discussed the fact that obviously we all know that not everybody has access to technology, and that there are many factors, age, language, cognitive barriers that really need to be considered. So before I go on discussing impact on carers, I just thought we could all answer another poll. The first question that I would please like you to answer is quite simple. It's would you say that as a result of the pandemic, you are now very familiar with online platforms, so Zoom, Teams, or WhatsApp? So please answer that. And then leading from that, so what have you used online platforms for? There's multiple choice there, and I might have forgotten some, but I just wanted to have an idea of whether people had used online platforms for something more in particular. I'm just going to take my answer. Okay, So let's see. So I don't know whether we're going to get the two answers in one go or one answer and then another. Okay. Okay, so yes. So in the first question, so most people are now very familiar with online platforms. I think that's quite important because although we all maybe had some, we all use maybe online platforms, the difference is that now we feel very familiar and we feel like they're everywhere and they're just part of our routine. So in terms of what have people used them for? Okay, so I mean, it's not surprising. Most people would use them to be in touch with their family and for social activities. And I think that is reflecting the information we found in the scoping review. Thank you very much for answering that. Close that. Okay, so there we go. So there was obvious evidence as well in the papers that we analyzed on impact of the pandemic and the restrictions on carers. So during the pandemic, carers have experienced higher levels of stress and exhaustion. In many cases, they have found themselves more isolated and being exposed to critical levels of stress because of having to manage very complex circumstances, but now with little external support. So carers expressed a concern about the deterioration in the symptoms of the person they care for, many times due to the lack of social interaction and cognitive stimulation. So obviously this deterioration then in turn led to increased complexity of the caring role they had to carry out. And then that led to an increase in the care burden. But carers also explained that they had found it very difficult to deal with the difficulties of balancing the risk. So in one way, they were thinking, okay, it'd be good to go for a walk, we need to get food, we need to get our medication. But on the other hand, they're being told to stay home, stay safe. So this sort of balancing act also led to anxiety and to worry. But very importantly, what many of the studies were identifying is that lockdown has had a negative consequence on the possibility of carers to access psychological and emotional support. So that has led to social isolation and has led them to feel disconnected from the support networks that they used to rely on or find support in. Interestingly, there was one of the studies from Tide that reported that carers had said that they had never felt less visible than during lockdown, and that they had felt that there had been a loss of identity as the media started referring to health and social care workers as carers. So the whole term carer had turned into a sort of a blurry definition. Carers also expressed that the impact of uncertainty had been quite big. So not only did they not know when social and health support service provision was going to be reopened, but also they didn't know and they don't know how it's going to look like, what is going to be the level of it. And also public health restrictions keep changing and they've had to be dealing with the uncertainty of how are these restrictions going to change and having to keep up to date with the restrictions. Finally, there in a number of studies, they report on ways in which carers have found coping strategies to deal with the isolation and with other restrictions. So they report, they call it passive strategies, for example, playing computer games or having phone conversations or reading, and other a little bit more active strategies, like going for walks and making sure that they had time for themselves. Also, one of the things that the pandemic has brought out and is reported in these studies is that communities have demonstrated a lot of resourcefulness, and they've continued to support their neighbors, and in this case, the needs of the carers and the people with dementia in their communities. And that obviously this support has contributed to the ability of carers to be able to continue to be able to provide the care they provide. So what did we find in regards to demographics? As I said at the beginning, our the picture of the participants in the studies that we included was not very representative of the whole spectrum of the community, but we did find some impact of different demographic aspects. So for example, we found that a number of studies report on greater impact of COVID-19 and the restrictions on people with dementia living alone. The Alzheimer's Society, in one of their studies, they found that during the first period of lockdown, people with dementia living alone were more likely to report an increase in symptoms such as memory loss and difficulty in reading or writing compared to people living with others. In their survey, they found that 56% of people with dementia living alone stated feeling lonely compared to 23% of people with dementia living with others. So quite significant. We also found, although we only one of the studies was based in a care home, we found that the Royal College of Psychiatry, in their report, they very clearly report on the impact that the visiting restrictions in care homes have had on the quality of life of people with dementia, and that this reduction in visiting times has led to an increased level of feeling of isolation and loneliness, as well as a reduction in the level of stimulation. We also found that illness severity did play a role in shaping the impact of COVID-19, and that the severity of dementia influenced the impact. So some studies found that a higher increase in stress levels in the relatives of people with severe dementia, but that this higher increased stress levels were linked to the fear of losing the support from paid carers. On the other hand, the stress levels of relatives of people with mild dementia were found to be mainly linked to the concern about the risk of cross-contamination and transmission and passing on the disease. In one of their studies, one study based in Argentina, they found that when comparing the frequency of behavioral symptoms within each dementia group category, anxiety, depression, and insomnia were more prevalent in subjects with mild dementia compared to subjects with severe dementia. The way they explain their findings is that comparatively, people with mild dementia might have suffered a more radical modification in their lifestyle. So their life would have changed a lot more than for somebody with severe dementia. And that this change is linked to reduction in social interactions and physical activity would have brought about more severe impact on symptoms.
2 minutes, Patri.
Oh yeah, conclusions, look at me, just on time. So our review has a number of conclusions, and I guess the main conclusion is that obviously there is evidence that there is overwhelmingly very significant impact of COVID-19 and the reduction in services on people with dementia and their carers, and that this impact needs to be addressed and it needs to be identified in more detail, but also that when this impact is going to be dealt with, it's very important to have the voices of people with dementia and the carers taking part in a shared effort to develop systems, support systems that are fit for purpose. Also that in terms of the restoration of services, there needs to be a balancing of online and face-to-face approaches, not a replacement, as we discussed before, and that things need to be fit for purpose and not just take a blank approach to everything. And that all there's a need to understand the personal experiences of people with dementia and their family carers of using technology, and also see how the factors as cognitive factors, age, geographical, all the things that can play an impact in access to technology need to be taken into account. But also, I think one of the things we identified is that there is not enough research or looking at how this technology is helping, or if there is enough evidence to show that it is working and it is addressing the problems. But also, I think it would be interesting and important to develop implementation guides that address the level of skill and the training required of those delivering online services. So far from our review, it looks like people were told, okay, now you have to deliver online services, get on with it. From the review, we kind of concluded that that is not okay just like that. That you would need to prepare people for delivering online services and see what people need to be supported to deliver the online services. So that's me finished, but I would like to say that in the CADR website, there are bilingual summaries of the scope and review for you if you're interested in looking in more detail as to what we found. The link is there on the slide, so feel free to access it if you're interested in learning more about it. Thank you very much, and I'll be happy to answer questions at some point, or now or later. I don't know how it works, but yes, thank you very much.